I'm Curt Sigmund from the Medical College of Wisconsin, and I am the Vice Chair for the Council on Hypertension and the Chair of the Programming Committee for this year's Hypertension Sessions 2019.
And I'm Dr. Jan Basile from the Medical University of South Carolina in Charleston, South Carolina, and the Ralph H. Johnson VA Medical Center, also in Charleston, South Carolina, and I am the Vice Chair of Clinical Programs for the Council on Hypertension.
We're here in New Orleans for the Hypertension Sessions in 2019, and I'm going to tell you a little bit about some of the events which are happening at our meeting. We're starting off the meeting with 2 keynote lectures. This year we've began to focus on the genetics of hypertension, something that has really advanced in the last few years. In previous years, the studies of hypertension have revolved around populations of tens of thousands and even hundreds of thousands. But in recent years, the studies of hypertension have extended into literally the population of millions of individuals. And we saw keynote lectures today from Dr. Mark Caulfield and Dr. Mingyu Liang on the genetics of hypertension. We learned quite a bit about some of the genes that are involved in this disorder and potential pathways forward for ultimate treatment. We have also have a recent advances in hypertension program that extends on the first 2 days of the meeting. This year we put particular emphasis on trying to translate both basic and clinical science together, and we picked 4 contemporary topics that we feel are really important for both the basic scientist and the hypertension clinician to fully understand. We're starting off with a discussion on the role of metabolism in hypertension and blood pressure control, what happens and what goes disarray in obesity and hypertension, and some of the neural circuits that are involved, which meld together the control of resting metabolic rate and blood pressure control. We also have a session on arterial stiffness and a basic science talk about the role of cytoskeleton and smooth muscle, as well as a clinical discussion of arterial stiffness as a measure in the clinical setting. We will continue tomorrow with 2 really important sessions. The first one is a very highly novel topic on the microbiome. That's the role of gut microbiota and the collection of bacteria that is in all of us, and how that regulates blood pressure and how changes in the microbiome can affect blood pressure and can cause hypertension. And then finally, we're going to have a session on circadian rhythms. Those are those rhythms that occur during the day and night. It's what goes awry when we take long plane flights and we have jet lag. And our blood pressure changes in response to our circadian rhythms, and we'll be discussing fundamental mechanisms that regulate these rhythms, and also how adjusting these rhythms through chronotherapy can potentially control arterial blood pressure in hypertension. With that, we also have a clinical program, and Dr. Basile maybe could tell us a little bit more about what's going to happen in our clinical program.
Thanks, Curt. This is the 3rd year that we are working closely as members of the Council on Hypertension to develop a clinical program of our 3.5-day meeting. And like we have in the past, we continue to be involved in the recent advances. For instance, we had 2 debates this morning. One debate was the ideal blood pressure screening tool. Should it be auscultatory or should it be oscillometric? We also had a debate on the ideal home blood pressure measurement. Should it be self-measurement or should it be 24-hour ambulatory monitoring? Curt and I work very closely together with large committees that oversee our tracks and our meeting. We have both a clinical practice, clinical science track that will begin this afternoon, and we have a primary care track where we reach out to all primary care clinicians throughout the world, but we also try to target local academic medical centers where hopefully they could come for the Friday afternoon and Saturday morning part of our overall clinical track, which we call the primary care track. This afternoon, even though we'll continue to be involved on Friday morning's advances in hypertension, this afternoon we will talk about the clinical pharmacology of hypertension, and we'll contrast the different classes, where do they fit in the management of hypertension based on blood pressure reduction and outcomes, of course. We will have another debate this afternoon, very, very important debates, two of them. One will look at, should less than 130 over less than 80 be the target blood pressure that we asked all clinicians and patients to achieve for effective blood pressure reduction. And the other will be an important question on what is the ideal initial, or is there a best initial agent to use in the treatment of hypertension. We will continue tomorrow with our clinical practice, clinical science track, and we'll be having a very interesting symposium that will look at blood pressure control in the Pacific Rim. We'll be specifically looking at China, Japan, Australia, and the United States in blood pressure control. And before that begins, we'll be giving out a very prestigious award, well-deserved, to Dr. Jeffrey Cutler, who is getting the Claude L'Enfant Population Health Award. In addition, we're going to have symposia on women and hypertension, specifically looking at pregnancy and post-pregnancy follow-up of hypertension, which we now realize that women that get hypertension in pregnancy really need to be followed more closely lifelong for the consequences, sequelae, cardiovascular consequences of hypertension. Curt, we've got some additional symposia on the cardiorenal syndrome. We've got a specific important symposium that starts Friday afternoon, and that's on blood pressure measurement in humans. As part of the AHA, we have scientific statements that come out. A most recent one was the measurement of blood pressure in humans, and this symposium will cover all the aspects of that important scientific statement. So much clinical, so much, basic. We work so closely together. Third year we've been doing this. It's a great partnership.
Thank you, Jan. Another highlight of the council activities at this meeting always is the awards. There are many awards that are given to outstanding colleagues who have made tremendous impact in our field. We have awards that are throughout the career cycle. We have a number of awards for poster presentations by trainees. That's a poster session that will happen this evening. And we have awards for early stage and mid-career investigators. And of course, we'll be celebrating the winners of our Dahl and Corcoran lectures as well. Of course, the highlight of the Council on Hypertension sessions always is celebrating excellence in hypertension research with the Excellence Award in Hypertension Research. And the recipient this year is Rhian Towers from Glasgow, Scotland, and she'll be discussing the role of vascular biology in blood pressure regulation and hypertension. And this promises to be an exceptional lecture and a celebration and banquet in her honor to follow. Well, Jan, I think we both described a really exciting program for the meeting this year, and we'll see everybody both at the poster sessions and the scientific sessions for the remainder of the time, Friday through Sunday.